Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Dr. Allan Warshowsky to speak on integrative medicine for common female disorders. Dr. Allan Warshowsky is a maverick in the field of integrative holistic medicine. Although conventionally trained, he is a leader in the field of integrative holistic medicine, treating men, women, and teens. In practice for over 35 years, Dr. Warshowsky's practice combines the best of conventional medicine with the latest in integrative holistic modalities. Dr. Warshowsky is a board-certified OBGYN, but no longer practices OB or does surgery. He is a founding diplomat and director emeritus of the American Board of Integrative Holistic Medicine, a member of the American Holistic Medical Association, the American Board of Obstetrics and Gynecology, and a respected member of the Board of Zymogen Advisors. He was a founding physician and director of the Women's Program at Beth Israel's Continuum Center for Health and Healing in New York City from 2000 to 2003. For more information, please visit his website at drallan.com. All right. Welcome, Dr. Allan Warshowsky, to the show today. Thanks for coming on.
You're very welcome, Laura. Great to be here.
Yes, it is. It's really exciting to have someone of your caliber in integrative medicine who has done so much to support women with hormone balance and now expanding your practice to men and teenagers as well. It's just so valuable. So today we're going to really focus on utilizing integrative medicine for common female disorders. I'd like to start off with talking about what are some of the most common causes of hormone imbalance, specifically for women of childbearing age.
Well, we need to look at the environment, and the environment includes everything from what you eat to who you eat with. And we're seeing, many issues in the environment, from our diet to environmental chemicals, that are all affecting our hormones. The environmental chemicals, there are tens of thousands of them. Only a few of them have really been studied, and they're only getting studied individually. None of them are really getting studied in the groups that we have in our bodies, the way we get confronted with these hormone disruptors. And they're acting like our own hormones, but they're creating imbalances in men and in women and in children, and we're seeing, a lot of this estrogen dominance coming from these environmental contaminants. We know them as the BPA that we have in soft plastic bottles. We see it in the polyaromatic hydrocarbons that come from our high heat food preparation. We see it in fluoridation from our water and chlorine. So these chemical disruptors are, throughout our environment, and that's not even considering the heavy metals. We know that there's arsenic in rice and there's mercury in fish. Lead contaminates our water and our environment as well. And these are also endocrine disruptors. They interfere with the way hormones work at the cellular level. And if the environmental chemicals weren't bad enough, our diets as well have promoted significant hormone imbalance. And if we look at the most common cause of endocrine problems in women, that would be polycystic ovarian syndrome, or PCOS. That has a major association with the metabolic syndrome. So sugar and carbohydrate metabolism problems, insulin resistance, very much associated with PCOS and contributing to the hormone imbalance and endocrine issues in women, especially estrogen dominance. A lot of this is coming from our last several decades worth of dietary advice, which included eating a lot of carbohydrates. 6 to 7 servings of whole grains per day was the main portion of our diet. Our consumption of sugary drinks, from diet soft drinks, regular soft drinks, sodas and juices, have 10 to 30 grams of sugar per serving, and all of this sugar and carbohydrates are increasing our pre-diabetic population. It's said that we have about 30% of the population that's already pre-diabetic. Certainly we've got 30% or more of the population that's considered obese. Now, these changes will affect our enzymes, and these enzyme changes and other changes that we see associated with these problems will increase estrogen production. And with these higher estrogen levels, women suffer from lack of ovulation. So the polycystic ovarian syndrome, which is, as I said, the most common endocrine disruptor disorder, is also the major reason for infertility, because as a consequence of estrogen dominance, women just are not ovulating. Lack of ovulation, again, would affect their progesterone levels. Women only make progesterone, which is the balancing hormone to estrogen. They only make this after ovulation. And with lack of ovulation related to estrogen dominance, we get further estrogen dominance. So it's kind of a feed-forward cycle. Unless we see significant lifestyle changes, it's very difficult to turn this around. I mean, conventionally, the treatment for polycystic ovarian syndrome is birth control pills, without even any consideration for the metabolic syndrome that accompanies it. So we're not really looking into why we're having these issues. We're just looking at it from the conventional perspective of ways of, just reducing the symptoms. In men, because of a lot of these same environmental and dietary issues, we're seeing an epidemic of things like gynecomastia. Men are kind of growing breasts and having increased abdominal fat and, starting even to look like women. And what we're seeing, if we measure their hormone levels, is that their testosterone levels are low and their estrogen levels are high. What they're doing is the same as what's happening in women through the action of these enzymes. The aromatase enzyme is one in particular, one that should be, fairly well known to women, because aromatase inhibitors are used for treatment in things like breast cancer. But we could use aromatase inhibitors from a natural perspective to reduce some of these changes in men that are causing these physical and also physiologic changes. We've seen reduction in sperm counts. When I was in residency in the 70s, the lower limit of normal for sperm counts in men was 60 million per cc. Now the lower limit of normal is 20 million per cc. Wow. So over the last 30 or 40 years, we've seen a significant drop in sperm counts. We could say from 60 to 20 million per cc. And all that we've done, in trying to deal with this is change our ranges. So we've made 20 million now normal, where in the 70s it was significantly low. And this is, again, happening related to these endocrine disruptors, these dietary challenges that we're all facing that are, promoting estrogen dominance in men and in women and in children as well. We're seeing precocious puberty, breast development in 9-year-old girls more and more these days, again, because of the same environmental issues.
Wow, it's a little scary.
And then, we've got to, and detoxification then becomes a major issue. We've got to get rid of all these toxins that are coming in through the environment. And, with the 21st century stressors, they said it was going to get easier as we moved into the 21st century and the computer age. All we've seen is more stress. People tell me I don't have stress because they don't really understand the meaning of what stress is. Stress can be anything from eating the wrong foods, to having somebody screaming at you all day at work. The body's response to these stressors is to create more of the stress hormones. So we get an increase in production of hormones like cortisol or adrenaline. And then these, again, make us less sensitive to insulin. So these are insulin desensitizing hormones, and they promote, again, that production of insulin resistance and the hormonal changes, estrogen dominance, that go along with that. It's a pretty bad scene out there, and, we see patients, so we're seeing probably 10 or more new patients every couple of weeks, and the vast majority are coming in with problems like fibroid tumors, polycystic ovaries. Men are coming in with loss of muscle tone, weakness, loss of libido. And if you're looking at, if you do a good hormone evaluation on these patients, they're all imbalanced.
So how are you checking for that? Like a new patient comes into your office and they have some sort of endocrine issue. You're running blood work to check all their different hormone levels?
Well, in New York State, we're a little bit restricted. There are urine evaluations for hormones. There are saliva evaluations for hormones. We do some saliva testing when we look at cortisol, because you want to look at cortisol throughout the day. It's one hormone that changes its levels, with the different hours of the day. So getting, 4 samples through saliva is a very good test to do. The saliva tests don't really give you a good sampling of the sex steroids. The urine evaluations are very helpful, but they're only showing the metabolites. So they're showing you what the body is breaking down and putting into the urine. That would be helpful information, but New York State does not allow that test. So we do primarily blood testing where we could look at, we probably look at over 10 or 12 different hormones, every hormone from pregnenolone, which is the first hormone made from cholesterol being the precursor to all of our sex steroids. Certainly cholesterol is not the bad thing that everybody, that the pharmaceuticals try to make it out to be. We need our cholesterol, and, one problem that I'm also seeing with hormone imbalances are women who are coming, these would be older women coming in, being treated with statin drugs for what looks like high cholesterol, and now their cholesterol levels are very, very low. And they can't make the hormones that they need. They can't get the fat into their brain that they need. Our brains are about 70% fat. They can't get that fat into the brain, and we can't even preserve our cell membranes, which are, mostly fat. So cholesterol, which has many, many uses in the body, is the precursor to all of our sex steroids. And I check everything from pregnenolone and DHEA and progesterone, which are the 3 primary precursor hormones in the adrenal gland. And then we look at the testosterone precursors, things like androstenedione, testosterone itself, testosterone breakdown products like the dihydrotestosterone, very important for male health and for women who are maybe having too much of that. And then we look at all the estrogens. So women make 3 different estrogens. Estradiol is the primary one in the ovary, and then estrone and estriol are other estrogens that are made, estriol being the weakest but the most protective. In addition to that, we check estrogen metabolites. So we check the hydroxyestrogens. The studies do show that there are 3 estrogen metabolites or hydroxyestrogens. They're called the 2, the 4, and the 16 hydroxyestrogens, whereas the 2 can be very helpful. The 4 and the 16 can go on to produce probably carcinogenic breakdown products. So we want to measure these because we have ways of restoring balance if they're not in balance. A lot of those ways of rebalancing these hormones and supporting detoxification, again, has to do with lifestyle changes. So we know that eating cruciferous vegetables, the broccoli group of vegetables, is very supportive for detoxification and for hormone balancing. We know that certain seeds, like flax seeds and maybe chia seeds, can also break down into substances that could support healthy detoxification. All of these things can then prevent some of the consequences of these hormonal imbalances, and one of the most feared is cancer. So we know that if you make more of the beneficial 2-hydroxyestrogen, and the next step is a process called methylation, and so if you can then methylate it, you have a very powerful cancer deterrent. But many people don't do that. And one other test that we do quite often is a DNA evaluation for a person's ability to methylate. So methylation, which is a simple biochemical process, really is extremely important in our body because it involves detoxification of hormones. It allows us to use our B vitamins because they get activated through methylation. It allows us to get rid of those toxins and heavy metals that I was mentioning before, are major endocrine disruptors, and methylation can also be helpful in protecting our DNA. So we check everybody for methylation defects, and we find that maybe 30 to 40% of the population has some genetic defect in their ability to do this very important process called methylation. So it's not just checking hormones. We also want to check the other issues that would relate to keeping these hormones in balance. We look at as much of the DNA as we can. We're still in the infancy of understanding what these DNA mutations mean. We really don't have a great handle on how to address all of these mutations at this point. So it could be a little bit dangerous for somebody to try to do, one of these kind of over-the-counter DNA tests. There are saliva tests that can be done off the internet, and they can give you a couple of hundred DNA test evaluations, but it's only a small part of the entire picture. So then putting together a protocol based upon those genetic changes, may not always be in the patient's best interest. And we also look at sugar metabolism issues because of the insulin resistance connection with hormone imbalance. We evaluate detoxification in other ways as well. We do certain urine testing. There's one test called organic acid testing that can tell you not if your liver cells are breaking down, which is what the blood tests tell you. If you had hepatitis and you had high levels of liver enzymes in your blood, it means all your liver cells are breaking down. We'd like to kind of get to that patient. We want to start restoring detoxification before the breakdown phase. So tests like organic acid evaluation can tell you if the liver is kind of running out of gas or needs an oil change. It's before the breakdown, so it's more of a functional assessment of liver detoxification. So these are just some of the testing that we do. I do a lot of testing in the first evaluation. The first time I see a new patient, we spend at least an hour speaking, talking about not only the problem that they're coming in with, but when did the problem begin? When were they last feeling healthy? Because this gives us extremely important clues as to what the initiating event might have been. Very often we see some inflammatory event. It may have been an intestinal infection, other kinds of infections requiring antibiotics. It could be something like Lyme disease or other infectious diseases that have a certain chronicity to them because they affect the body throughout, many different systems. Detox becomes affected. Our barriers to inflammation and toxicity become affected. Most people I see, I would say, have what we call leaky gut. Leaky gut meaning that the intestinal cells become more permeable to toxins, bacteria, and other large food proteins that then affect our immune system. 70% of our immune system sits around the gut. Their primary job is to differentiate what's us from what's not us. And when they see large proteins coming through the gut wall, it looks like an infectious process, and they make antibodies setting up the inflammatory response. Now, this is something that we've known for quite a while. Some new information that's coming from these investigations is showing that not only do we develop a leaky gut, but we also develop a leaky brain. And so a lot of patients come in with brain fog, memory loss, mood issues, and it's because the inflammation that is starting in the gut because of leaky gut is now affecting their brain, and they're getting a leaky brain. The blood-brain barrier, which is supposed to prevent toxins from entering the brain, is no longer effective. This chronic feed-forward inflammation cycle will then again affect our hormones and also contribute to estrogen dominance.
Mm-hmm. Wow. I have your Healing Fibroids Naturally book in my lending library, and I hand it out to patients. I would love for you to share some of the information that's in that book for women to understand how they can make lifestyle changes to help with hormone balance.
Well, it's again the same two issues that we're looking at. We're looking at inflammation and hormone imbalance, or estrogen dominance. So estrogen dominance is what's creating these abnormal fibroid cells, these abnormal uterine cells. And then whenever there's an inflammatory chemicals, and we call these the cytokines, so interleukins, interferons, these are the proteins that are messengers in the body of inflammation. These inflammatory messengers enable the abnormal cells to develop their own blood supply. So angiogenesis, the formation of new blood vessels, is really the only way that abnormal cells can grow. Whether it's a benign tumor or a malignancy, angiogenesis, or the creation of new blood supply, is key for that tumor to grow. There have been, medications produced and studies done on reducing angiogenesis. The medications generally fail because of severe side effects. Avastin was one that was created as an anti-angiogenesis factor, but there are natural ways of reducing the blood vessel formation in the fibroid cells, and that's identifying the sources of inflammation and reducing them, and identifying the sources of hormone imbalance and rebalancing them. So that's our initial evaluation, looking for what's creating inflammation. And again, it could be your boss yelling at you every day at your job. It could be a memory, a post-traumatic stress disorder kind of issue that you're constantly reliving, a traumatic issue from your past. It could be the dietary issues that we've mentioned in brief. It could be an inflammatory gut. It could be inflammatory bowel disease. Or it could be an infectious disorder. So we want to look for what's contributing to inflammation, because we know that these inflammatory chemicals are going to create more blood supply to the fibroids. And then there are natural ways of reducing blood vessel formation. So we use green tea extract. We do a fair amount of green tea extract both orally, and we could use that as vaginal suppositories. This reduces these inflammatory chemicals. Curcumin. So this comes from the spice turmeric. We use curcumin as another anti-inflammatory that would help to reduce these messenger molecules of blood vessel formation. And systemic enzymes. So we do enzymes on an empty stomach. We don't want to break down your food with these enzymes. We want to break down these inflammatory proteins and perhaps the proteins in the fibroid itself. So anti-inflammatories, green tea, curcumin, systemic enzymes, these are the ones that have serrapeptidase in them. These are enzymes that have been shown in good studies to reduce these inflammatory chemicals. And then, we use also herbs to rebalance the hormones. So chasteberry could be an herb to support progesterone, as is sarsaparilla. So we use combinations of these herbs as well to help to rebalance the hormones. In the past, we did use progesterone in an attempt to balance estrogen. Progesterone is the major hormone that balances estrogen, but new information has shown us that progesterone can, in fact, get fibroids to grow. Now, clinically, I had seen that happening. We didn't exactly know why, but we found that fibroids that were in the lining of the uterus, we call these submucous fibroids. These are the ones that cause the most bleeding problems and the most pain problems, because the uterus is trying to expel these fibroids as if it was trying to deliver a baby. They're in the same place that a baby would be, that a fetus would be. So these submucous fibroids, tend to be much more symptomatic, and sometimes they can even be pushed out of the uterus, and we call these aborting submucous fibroids. But the progesterone, we know, affects that lining area that would support a developing embryo or fetus. And because of that, I always felt that it would increase blood flow to any fibroid that was in that vicinity. And I stopped using progesterone years ago. Recently, I have found research that shows that it's really more about the progesterone receptors. So every hormone that we could think of that works within our cells can only get into those cells if there are receptors. These are proteins on the cell membranes that are like doorways into the cell for a specific hormone. So it's kind of a lock and key kind of a situation where each hormone is a specific key for a specific receptor site. And different receptors for different hormones can either increase or decrease inflammation. So we know that with estrogens. They have an alpha and a beta receptor. The alpha receptor, when it's more concentrated, is very inflammatory. So we see this in breast cancer. We see this in fibroid tumors. We also see the progesterone receptors. There's an A and a B. If you have progesterone receptor A, it's going to turn on more inflammation if you give progesterone. If you have the B receptor, it'll turn down inflammation. But at this point, commercially, we have no way of identifying those receptors. These receptors are first being identified now by research being done in animal studies. So we want to be able to balance the hormones without the use of other hormones like progesterone, and that's where the herbs will be very helpful. We also want to reduce symptoms. Now, the American College of OBGYN has said in its practice management guidelines that fibroid tumors are mostly benign, and because they're mostly benign, unless they're causing symptoms, you could leave them alone. They don't even talk about size. They don't say leave small ones alone and take out big ones. They just say they're benign, and if they're not symptomatic, you can leave them alone. So what are the symptoms that we see? Well, growth is one. So if the fibroids are growing, that's certainly something to be concerned about. And that might be related to the maybe 1 in 300 incidence of malignant fibroids. Fibroids also cause very heavy menstrual bleeding to the point of some women needing blood transfusions. So we want to be able to curtail that bleeding. And then there's the pain that comes along with the fibroids themselves. So we use castor oil packs as an anti-inflammatory. These are hot packs that are wetted down with castor oil and put on the lower abdomen, where they work to reduce inflammation and can be very effective as well as a mind-body tool. So we put together a visualization exercise where the patient would visualize the blood flow to the fibroids and then visualize the herbs and the enzymes that we're using getting into the fibroids where the fibroid can then shrink. And then they visualize the blood supply turning into pipes with turn-off valves, and they shut down the blood supply to their fibroids. And that's a visualization that they could do as often as it works for them. Now, I've used these kinds of visualizations years, back in the 70s and 80s. I was using this blood vessel to pipe visualization when I was doing any kind of surgery to reduce blood flow. There were some studies from the West Coast at that time, I think coming out of Stanford, showing that visualization, meditation, visualization exercises preoperatively reduced operative blood flow. So we've been using these kinds of visualizations for many years, and we find them very effective. One thing that the mind-body approach helps with is identifying some of the stored emotional issues that may be interfering with healthy energy flow in the pelvis. So if we talk about the energy centers from the Eastern perspective, they're called chakras. The second chakra is the pelvic chakra, and this is the energy of relationship. So not just the people, but the entire outside world. So this could be associated with things like job or control issues, financial issues, work stress. This is also the center of creativity. So we want women to be aware of what do they have in their life that they don't want, or what is not in their life that they do want. And then all the abusive issues that, women unfortunately suffer regularly sits right in that second chakra. So when they're doing their meditation visualization exercise, they want to be aware of any of these thoughts, memories, ideas that come up that would be interfering with the healthy flow of energy in this second chakra. Now, we know that there's a sound basis for this because that's how acupuncture works. Acupuncture needles the meridians. These are the channels of energy flow through the body. It needles the meridians to get rid of the blockages. And a lot of the stored emotional issues that we all do, so this is not a blame game, and, some people have said, oh, you're blaming me for my fibroid. We all store emotional issues in different parts of our body. You see people that are, hunched over, carrying the weight of the world on their shoulders, people who are, have a closed heart or are hard-hearted, or, these are expressions we use, but what they really mean is, these are stored emotional issues that we're suffering with. Now, journaling, the simple writing down of these issues has been shown to be an effective way of eliminating some of these emotional blockages. So these are, of course, dietary change is very important. We're now recommending more of a Paleolithic type of a diet. So this is reducing carbohydrate intake. And there are studies, if you look at the literature, there are studies that show that women on a low-carbohydrate diet have reduced inflammation. And that makes a lot of sense because at a higher carbohydrate diet, the insulin levels are much higher. And insulin is not only a fat-storing hormone, insulin is also an inflammatory hormone. The fat storage that insulin creates is also inflammatory. We used to think fat was inert and didn't do anything, just kind of sat there. But now we know that fat, the adipose cells, are endocrine organs on their own. And, some of the most damaging hormones or messenger molecules they're making are inflammatory molecules or inflammatory hormones. So, weight management, the Paleolithic diet, which is eating mostly above-ground vegetables and organic and grass-fed meats and poultry, and fish and eggs and other organic sources of protein would be the mainstay of that diet. Now, I just mentioned organic and grass-fed because when I wrote the book, that didn't exist. It wasn't even known. We weren't even talking about it. But now, and so when we wrote the book, it was elimination of these inflammatory meats and poultry, because the commercial forms of meat and poultry are fed grains. They're fed corn, they're fed wheat, the same grains that we don't want to be eating, especially these days, because in this country, at least, they're all genetically modified. So the FDA, in all of its wisdom, has now allowed for the total genetic modification of all our gluten grains. Gluten was a problem in the first place because gluten increases, and again, the studies are there, gluten increases intestinal permeability. So if you have no other problems, if you're perfectly healthy and you're eating a lot of gluten, then you most likely have leaky gut because of the action of gluten on the intestinal cells. Now gluten is even worse because all the gluten in this country is Roundup Ready. Roundup, the herbicide from Monsanto, also called glyphosate, has been banned in the UK as a probable carcinogen. I don't think any country in Europe uses it. China has turned back our wheat. They won't even take our wheat because it's all GMO, genetically modified. All the corn and soy in this country has also been given the go-ahead by the FDA to be also GMO, and they're using an herbicide called 2,4-D. 2,4-D, I don't know how old you are, Laura, but comes from something called Agent Orange, which my generation knew quite well as the defoliant that Dow Chemical used in Vietnam. And we're still seeing servicemen who have severe neurological and other chronic illnesses related to their exposure to Agent Orange back in the 60s and 70s. And that's what they're putting in all of our corn and soy. So these are foods that we would have eliminated from the diet because of their carbohydrate content and their effect on insulin. These days, they're much worse. They're much worse because of all the genetic modifications and the fact that you always get these residues, these herbicide residues. The organic and grass-fed meats and poultry, on the other hand, if they are grass-fed, they're going to be making anti-inflammatory oils the same way the deep-sea cold water fish would contain. So Pacific salmon and sardines, they're not making fish oils. They're accumulating fish oils because they're either eating the algae or they're eating the small fish that eat the algae. So these fish are giving us the anti-inflammatory fish oils because they're eating greens. And if we get meat and poultry that are organic and eating grass or their greens, land greens, they also will be making anti-inflammatory oils instead of the inflammatory ones you would get if they were grain-fed. So we incorporate the grass-fed meats and poultry and the above-ground vegetables, and we try to put a diet together that's mainly that.
Wow, so much information. And I know you're also an advocate of obviously avoiding gluten, but then dairy as well.
Well, dairy is kind of a mixed bag. Not everybody is sensitive to dairy. The problem is probably that the dairy, the casein, cross-reacts with the gluten. So there are gluteomorphins in gluten. These are the proteins in the gluten. And unfortunately, there are caseomorphins in dairy, and they can't cross-react. So some people will have the same kind of reaction to dairy that they would have to gluten or to wheat. Other grains like millet can also cross-react with some of the gluteomorphins. Again, New York State being one of the most restrictive states in terms of their testing doesn't allow us to do that kind of testing, but it is available in other states. There's a lab called Cyrex, CYREX, that does about a dozen different panels looking for these allergenic proteins and what other foods may also be contributing to these food sensitivities. So the food sensitivities are, again, another source of inflammation, because these are foods that are coming through this leaky gut. And the foods coming through the leaky gut wall are attacked by your immune system. The immune system makes antibodies against these proteins, and now these proteins from the food is a source of inflammation. So the more you eat them, the more inflammation you have. So when we do an elimination diet, which is something that we often start off with, so we might do a 4-week allergy elimination diet along with a cleanse, a detox, allowing a healthy paleo-type diet and eliminating all of the more allergenic foods like the wheat, like the dairy, the eggs, the corn, the soy. We also include in that group any food that the person craves and eats regularly. So if you crave it and you eat it regularly and you have any indication of leaky gut, you are most likely making antibodies to that particular food, and unless you get it out of your diet for a period of time, every time you eat it, it will increase inflammation. So 3 or 4 weeks is a good amount of time to get off of these foods. We use nutrients to support healing of the gut, things like glutamine and zinc, probiotics, beneficial yeast products like Saccharomyces boulardii, berberine. These are all substances that have been shown to help heal the gut lining, and we would do that for 3 to 4 weeks along with an allergy elimination type diet. Most people feel much better during this 4-week phase. Most people would lose a fair amount of weight, maybe over the 3 to 4 weeks they would lose up to 10 pounds. This is mostly water weight because we're reducing their inflammation, and in the reduction of inflammation, they're no longer holding on to water. I mean, you know that if you look at somebody that's, inflamed, they look swollen. They look swollen, they look puffy, because their body is trying to dilute these inflammatory chemicals that are sitting in their, around their cells by putting more water outside of the cells. In fact, that's one of the tests that we do in the office on the first visit is a body composition analysis. And one of the aspects of that test is looking at the levels of intracellular and extracellular water. So a healthy person will have about 60% of their total body water in their cells and 40% outside. Most of the time we're seeing the reverse. So we'll see 50 to 60% of the water outside of the cells and a much smaller proportion within the cells themselves. So these people, whether they're drinking fluids or not, are intracellularly dehydrated. And again, that just perpetuates the entire problem.
Right. Wow. So,
now,
I want to. Oh, I'm sorry. Go ahead.
No, go ahead. You can just go. Look, I could talk forever.
I know. I love it. I'm so happy with all this wonderful knowledge and wisdom you're giving our audience. One last question I wanted to close with. A lot of the women listening to the show recently have given birth, and certainly pregnancy can create a lot of hormonal imbalances as part of the pregnancy itself. Is there things that you can recommend for a woman after giving birth that can be really helpful for her to help with, even systemic joint pain and other issues that can be like an autoimmune reaction from the pregnancy hormones?
Well, it's interesting that there's actually a form of postpartum thyroiditis, a thyroid inflammation that looks very much like what we call Hashimoto's thyroiditis, an autoimmune condition that creates most of the low thyroid problems in our country. And this can happen just from giving birth. And we see this as a postpartum thyroiditis that will go away, and women just kind of need to be supported through it. Now, and there are no studies on this, but my suspicion is that it's the abrupt decrease in progesterone that's causing a lot of these problems. Now, we do know that autoimmune conditions are more associated with women. That's actually changing, and more men are now developing autoimmune diseases that were almost always in women. Hashimoto's thyroiditis is one example. I would say up until 10 years ago, it was almost always in women. Now I'm seeing it in many men as well. And this, I'm pretty sure, is related to estrogen dominance again. We don't have, a total handle on the reasons, but most people and most researchers feel it's another aspect of estrogen dominance. And so that would go along with the abrupt decrease in progesterone that happens after delivery. The abrupt decrease in progesterone can also be responsible for difficulty nursing. It could be responsible for postpartum depression or postpartum blues, and may also be associated with some of these other issues that you mentioned, like joint pains after the pregnancy. Many women that I work with are using a 3% progesterone cream in the luteal phase of their cycle, that means after ovulation, when the ovary would be making progesterone. Many of these women with polycystic ovarian syndrome or with estrogen dominance, even if they are ovulating, it tends to be an inefficient type of ovulation, and they don't make enough progesterone. Some of these women, if they have a sonic or pelvic sonogram done, will have a large fluid-filled ovarian cyst. It's like the ovary is trying to enlarge to make more progesterone. So we support the progesterone by giving them a 3% cream, and this is a physiologic dose. It's just really giving back women what they would be making in a normal, healthy ovulatory cycle, about 30 to 40 milligrams of progesterone a day. Now, we continue, if they do get pregnant, we continue the progesterone at least until 12 weeks of pregnancy, because that's when the placenta will start making tons of progesterone. If they stop using their own progesterone too soon, they would be more likely to miscarry, because the progesterone, as it's named, progestation, it's for gestation, for pregnancy, to maintain the pregnancy, and then we actually have them continue the progesterone cream, this 3% cream, right through the pregnancy without taking them off of it. The 40 milligrams that they're using from the cream really doesn't make that much of a difference, because the placenta is making thousands of milligrams of progesterone. And then when the pregnancy is over, after they deliver, they don't appreciate that same abrupt droppage in progesterone because they're still using the cream. So I would say one very effective way, and without any downsides, is to use one of the 3% progesterone creams. If you're an older woman trying to get pregnant, it would certainly be helpful, because we do know that older women have an increased incidence of miscarriage in the first 6 weeks of pregnancy, and this is most often related to a deficient luteal phase, a deficient progesterone production. So getting on the progesterone cream is going to be a helpful way in terms of getting pregnant, maintaining pregnancy, and then possibly reducing any of the negative effects after the delivery. Now, something else I use a lot of in pregnancy, and we do this because, there aren't a lot of, tests for supplements in pregnancy, and you can't take 100 pregnant women and give them a supplement and take another 100 and not. That's not, we can't do that, so we have animal studies, but we could use homeopathy. So homeopathy is without any side effects. This is using basically, water pills, that have been, connected or shaken up with some substance. So for things like joint aches and pains, we might use a homeopathic remedy like Rus toxicodendron. So Rus tox, which is actually poison ivy, they create this remedy by shaking up essence of poison ivy in water or in alcohol, and then they dilute it hundreds of times until there's no poison ivy in there. It's really just water molecules. but the energy of the substance has changed the configuration of the water molecule. That's the theory of how it works. And you can use a homeopathic like Rustox for joint aches and pains. We use other homeopathic remedies during pregnancy, so for nausea and vomiting of pregnancy, a major issue, we could use homeopathic remedies like Ipecac or Nux vomica. Again, these are basically sugar pills that the water has been shook up with the essence of the substance and diluted to the point that there is no substance left, and all we're looking at is a change in configuration of water molecules. So I would say the use of progesterone cream, very effective in pregnancy, to get pregnant and after pregnancy, and for symptoms during pregnancy and certainly afterwards. And I think for newborns and infants as well, homeopathy is very safe, very inexpensive, and it either works or it doesn't do anything.
Right. Yeah, it's so valuable, and so it's good for women to know they can use this during their pregnancy. It's also safe to use if they're nursing postpartum. A lot of women are, concerned about things getting into the breast milk, but something like homeopathy would be safe to use.
Extremely safe.
Yeah. Wow. Any last thoughts you'd like to leave our audience with?
Well, my concern is, for our environment. We live in a very toxic environment these days, everything from the news, the media, to the food we eat, the air we breathe, the water we drink. It's all loaded with toxins. You might have seen the Colorado River has, turned, a putrid shade of tan because of a major metal spill into the river. It's going to contaminate for decades. So these are problems that are confronting us every day. And the best way of dealing with it, we can't eliminate it, so the best way of dealing with it is by constantly detoxifying. So I recommend techniques like dry skin brushing, Ayurvedic techniques like oil pulling, using a detoxifying powder, maybe fasting one day a month or a few days every season. So there are ways that we could support the healthy detoxification of our bodies, and this is probably the most important thing that we need to do, while we're still living in this very toxic environment.
Wow, so powerful. I completely agree, too. So thank you for sharing, and if people want more information, they can check out your website, drallan.com. Thanks again for coming on the show.
You're very welcome, Laura. It was great speaking with you, and I hope that your listeners will get some good information from this.